Hey, what's up, guys? I just want to tell you that this video you're watching, it's just a clip. You could watch the full episode on our YouTube channel. Also, you could check the whole episode on all platforms where podcast streaming is available. Yeah, let's talk about Dentuit. I mean, if for our listeners who aren't familiar with the dental AI, could you explain to them
Sure.
what Dentuit is to the dental world?
Sure, of course. So Dentuit is basically dental artificial intelligence technology, basically. More specifically, it's a clinical decision support system, if you want to look at it that way, for providers and even payers. Payers meaning the dental insurance carriers here, at least in the U.S., because of the way that the insurance works here, compared to maybe other non-U.S. countries, there's a lot of fraud, waste, and abuse that also occurs when you're submitting claims in a certain way. And so there's opportunities there too, and I can talk about that as well. But the main kind of driving force behind Dentuit and the reason why and the use case that we had in mind when we started Dentuit was to be able to seamlessly support the dentist while, like my brother, is reading an X-ray, to be able to get some extra opinions and support information that is also rendered on that image, so that the patient is not only getting the kind of the advice and a diagnosis based on just one person's interpretation of an image that they see or an X-ray that they see, but rather the dentist's interpretation combined with countless numbers of dental experts that has been involved in developing our model. And so that is what we mean when we say consensus-based clinical decision support. That consensus is an extraction, a derivative of basically how we train our model to then provide the inferences that ultimately render as these kind of colored indicators on these X-rays that the dentist is looking at. And so how we train it is we have input, right, including yourself, Paulo, from various multiple dentists, not only from a specific region, from all over the world, and also be able to kind of feed new data, images, and X-rays to the model that are diverse and are kind of generated by multiple sensors. And so that kind of plays into the other aspect of our goal and our mission, is that we want to not only seamlessly support the provider in that workflow and provide as much non-biased information as possible for the patient as well at that point of care, but to be able to do it across any region and any location, such that you can use any sensor, any imaging software, and be confident in knowing that you can download Dentify, which is the name of our product or service, and download Dentuit and effectively still get the benefits and get started right away in the easiest way possible. So we kind of look at that as our kind of primary objective are we making their process more difficult, or are we making it a lot more easier? And if we're making it a lot more easier while kind of improving the quality of the diagnosis, that being kind of allowing the dentist to kind of detect early lesions like cavities early on before waiting too long, and then you have to do the drill and fill, but maybe present more opportunities to kind of go down a more minimally invasive route. That's the beginning, I think, of a transformation that you'll see in dentistry. So I do think Dentuit is a small part. Dental AI is a small part. It will be hype and nothing but hype to say that dental AI is the future and that is the solution to all your dental problems, because that is simply not true. But it is a part. It is a player. Maybe not a small part, but it's certainly a player, not the main thing, but just a role towards transforming dentistry into a lot more evidence-based care, that you're not so worried about the bias of that one dentist kind of influencing the treatment plan. I know there's a lot of concerns amongst patients, right? Where, why is he telling me that I have so many cavities? I don't feel much, but it seems like he's just trying to now make a quick buck off of me. Those type of questions need to be nullified, because we're talking about healthcare. This is not some cosmetic treatment that you're going, and saying that off a menu you want this and this done. But the thing is, that is somewhat the case in dentistry today, at least in the U.S. anyways. It's sort of like, I want to get this tooth kind of treated and fixed, but maybe I'll pay for that tooth later. Something along those lines. That kind of very kind of consumer-based approach. There's good benefits that come from that type of model for sure, at the same time, we're talking about healthcare. It shouldn't be this idea of kind of fundamental compromises to your health due to a menu-based pricing scheme or something along those lines. And so, if we can standardize and normalize the dental care in a little bit more kind of consistent manner, no matter where you are as a provider, no matter where you are as a patient, and no matter what your economic and background is, that you will get fairly good dental care no matter who you see. No more of this kind of, man. Is there another dentist that you can refer me to that really many people would trust? Kind of going off that connection route, but just knowing
Yeah.
that they use Dentuit or some dental AI technology, at least confirming that understanding will then give you this sense of more confidence in the care that you're getting. Because my brother jokes around all the time, Paul. I don't know about if that happens to you, but my brother always jokes around saying that every time he leaves a room, the operatory room, he always kind of overhears his patients kind of
Yeah, yeah.
like whispering to the assistants or the hygienist and asking them, by the way, you think Dr. Lee's suggestions are right? Like, is it too much? Is it too little? Like, what do you think? And they always try to get some kind of affirmative kind of confirmation from the people there. But the thing is, like, my brother jokes around saying that they've already had a story kind of planned out and everything, and so the assistant already knows this coming, and so the assistant is just like, oh yeah, absolutely, you need. Yeah, Dr. Lee knows what he's doing, and yeah, everything that he says, yeah, definitely go with his suggestions. And so they work together in that sense. But
Yeah.
if there's a way where we can kind of minimize the bias there and really kind of present a more standardized approach to at least identifying issues in an X-ray, ultimately we don't diagnose. That is that is another thing that a lot of people kind of mistaken Dentuit for is also you automate the diagnosis of certain lesions or whatever, and we don't. What we do is we optimize the opportunities for the dentist to make the best possible diagnosis every single time. Not when you're up in the morning early and you're seeing your very first patient, you're fresh, you get you just had your coffee and you're on a roll and your diagnosis is on point. And then maybe towards 4 p.m. you're kind of fading out and your diagnosis is maybe not quite up to par or whatever. But being able to make that more consistent with technology like AI is very much possible, and I think is very much needed for sure.
Yeah, man. Actually, that's the cool thing about it. Like, of course, there's going to be patients or insurance who would be doubtful if you marked something as a tooth filling or a cavity, and having something as a dental AI where they're gonna see it in the app, and they are sure that it wasn't made by someone I know personally. Because usually they would think I'm in connivance with someone else if they ask for a second referral. At least
Right.
they would have that thinking that, hey, there is really something in this tooth, and it's what's going to happen. And for us dentists, the cool thing about it is that it minimizes eye fatigue. I've always said this, that if you have multiple patients coming, especially during the pre-pandemic phase, sometimes you tend to overlook some cavities because you're already so tired from doing the treatment.
Right.
Or sometimes if you have an x-ray and you need a second opinion, sometimes you DM your friends who are also dentists, and sometimes you don't know when they are going to reply. But having an AI like yours, it's going to have instant results as soon as the x-ray would come. I mean, as soon as you
Right.
put it in, it's going to show. Oh, look at that. You watch until the end of the show. Like, don't forget to subscribe to all our social media accounts. Also, don't forget to share it with your friends and like comment down below if you have thoughts regarding it. I'd love to read it.